Senior Connections, a show about senior issues and events. A guide to active, independent living. Senior Connections, with your hosts, Margie Toms and Janet Halliday.
Good afternoon and welcome to Senior Connections. I'm Margie Wimberly Toms.
And I'm Janet Halliday. Today we are talking with Dr. Alan Brill about the aging face. So all of you ladies and gentlemen who would like to have those tricks about looking younger, pay attention. Welcome to the show, Dr.
Yes.
Brill.
Thank you for
Welcome,
having
Doctor.
me. Yes.
Why don't you tell us about your specialty and what your certifications are?
Okay. I've been in Columbia since 1977, and I practice otolaryngology, which is ear, nose, and throat, and facial plastic surgery. I'm board certified in both specialties, otolaryngology and facial plastic surgery.
Okay.
So the ABFPRS, what is that?
American Board of
Board.
Facial Plastic Surgery.
Okay.
Very good.
And now you start, I was saying before we started, you started a long time ago with me, with my son, and put tubes in, but recently you have really gotten interested in more of the cosmetic side of things.
I've always been interested in cosmetics, but in this stage of my career, I've sort of focused more on the facial plastic surgery.
Oh, okay. So that's fairly new for you compared to the EENT work that you were doing?
Well, I was always doing facial plastics, but made more of a effort, I would say, to focus on facial plastics by getting board certified in it.
Yes.
And marketing for facial plastic surgery, and sort of tailoring my practice for that specialty.
Oh, all right.
But the thing that I noticed more about Dr. Brill, having seen him recently and talked to him about this, is you just get so excited about talking about it. You're enthusiastic. You really enjoy, I think, bringing a whole new look to the patient. And you can tell it. When
Yes.
when he's talking about ears, he doesn't get too excited.
Well,
but when he's
it's-
talking about
it's understandable. He can see a big change with
Right,
the ears. You know, it's a little
right.
different.
right. Well, I want to talk about first the least invasive, I guess, would be Botox.
Well, Botox and injectables have really taken off. It's no downtime, easy to do, affordable.
Okay. Now, I do have one question though. If you're younger and maybe you start to have a little bit of wrinkles, if you're getting Botox, will that keep you from getting wrinkles?
Not necessarily, but I think it will help your wrinkling problem. People that tend to frown or have a very animated face, I think it will help not get those deep lines in the future.
How long do the injections last, doctor, before you may want to have another one?
Usually 4 to 6 months, and everybody's different,
Yes.
and some may require more than others. But it seems to me that the patients that receive Botox, you know, really enjoy having that, and they frequent me quite often.
I think
Yeah.
that.
I just want to find out, up here, anything in this area?
It's good for the crow's feet and the forehead.
Yes.
Now, it
primarily.
is used in other areas of the face. It can be used for the marionette lines around the mouth or
I
the
see.
lines in the neck, but most commonly around the eyes and the forehead.
Sure.
Now, what are the side effects? I mean, what allergic reactions, anything like that?
The most common question I get, well, I look like I have a, quote, plastic face. And I say basically no, you can still animate your face, you still have facial expressions, but your facial expressions will be much softer. And the main complication of Botox is that if it migrates, you can get a droopy eye, a droopy eyelid. But the good news is it's transient, it doesn't last.
Yes.
And about how many injections does it take for the average patient?
We usually talk about units, how many units a person gets, and anywhere from 20, 24 units, which is usually a 1 cc syringe. And there are multiple injections around the eyes and the forehead, but it's very small amounts of Botox being put in each place.
So if I wanted Botox, then is there anything I need to do to prepare for it?
Not at all. You just come in and you can have some numbing cream put on your face, but it's really not a painful procedure.
Okay. Would you say the cost?
The cost is around, it varies depending on how many units, but it could be $300 or $325.
That seems reasonable, I think. And if you are looking to use money for Medicaid qualifications and you need to talk about funeral expenses, please give Cornegay and Mosley a call and we'll be right back.
Senior Connections brought to you by our premier senior providers offering exceptional services for older adults. Our premier senior providers include Senior Living Guide, serving the Midlands for more than a decade. Life Care Center of Columbia, doing whatever it takes and then some. Harry Crosby, educating people on solutions available for long-term care for almost 20 years. Brookdale Senior Living, providing exceptional senior living for over 30 years. Aging Gracefully, a senior living consulting service.
How have these homeowners achieved greater financial flexibility? With a reverse mortgage from a trusted source, MetLife Bank. If you're a homeowner age 62 or older, a reverse mortgage could make a difference in your life too.
It is the best thing we've ever done. I am so relieved.
It really lets me sleep at night.
Why not learn the facts today from a MetLife Bank reverse mortgage consultant? There's no obligation.
Welcome back to Senior Connections. We are continuing to talk with Dr. Brill, who is telling us about the aging face and the cosmetic work that he does. Dr. Brill, tell us something about these Botox parties that you hear people have out in California and elsewhere. How safe are they? What do people really need to know before they go to one of these parties, etc.?
Well, first I would think you ought to know who's doing the injection, what are their qualifications. Do you want to really have a cosmetic procedure with a group of people, or would you like more of a one-on-one situation? I personally prefer a more one-on-one situation to be able to discuss it in private with my patient rather than having a group of people involved in treating each patient individually.
Now, having looked at some of the what are the qualifications for being able to inject Botox? I mean, it says something about just a healthcare professional.
Well, I think a lot of people have gotten into the injection business. They're not necessarily board certified in facial plastic surgery or plastic surgery. They may have just taken a course, and that would be their only qualifications for injecting Botox.
Yeah,
Good to know.
I even found it on the internet, how to inject, and I thought,
is that
boy,
right?
oh boy.
Yeah.
You can find out anything on the internet. But I want to talk a little bit about the derma fillers. Now, on your pamphlet, you just used the Restylane and the Juvederm.
Juvederm.
Tell us what the difference is between those two products.
Well, they're both hyaluronic fillers. And each company says that theirs is a little bit better, or it injects smoother, or lasts longer, or is you can use it in the lips versus around the mouth. But I have found them all to be relatively about the same. The only one that is a little bit different is Radius, which tends to last maybe a little bit longer, but it's a different product altogether.
Now, what area of the face are we doing the fillers?
Mostly around the mouth and the lips. These nasolabial lines around the mouth, or enhancing the lips, or helping these small little lines that are around the lips.
Is that the one where the people who want their lips to be larger? Is that the
You
procedure?
can do a lip enhancement with the fillers.
Oh, okay. Interesting.
And how long do the fillers typically last?
9 to 12 months.
9 to 12 months.
That's a little while.
And what's the how many injections does it take? Is that just per individual, or?
You have to look at each patient individually. You may only require 1 syringe, or you may require 2 or 3 syringes, depending on how deep your wrinkles are and what you want to enhance.
Yes, yes.
So if you went in and you wanted to increase the volume of your lips, then how often do you have to come back? Just about once a year?
I would say 9 to 12 months.
Okay.
And what's the average cost for
Yeah.
something like that?
That could be $500 to $1,000, depending on how many syringes you use.
Interesting. So if you get tired of your lips being large, then you can just let it slide. You don't have
That's
to go
right.
back.
That's right.
Or be happy you have large lips. That's the other one. Well, I didn't know anything of this. IPL treatments. Tell me what that stands for.
Intense pulse light. It's just a form of laser treatment.
Yes.
It's really a laser that's used in the office with very little downtime to help rosacea or red spots or uneven pigment on the face. And you have a series of treatments with it.
Would that be pertaining to moles also? Or no?
Usually not moles, but just sort of crusty areas or some broken veins in the face.
I see.
It's more of a procedure you
Laser
can come in and
treatment.
have at lunch and then go back to work.
Yes.
Boy, that'd be great for everything. But what's the difference between that and like a chemical peel or a microderm?
The microderm is very similar to the intense pulse. It's a relatively low invasive type of treatment, but the chemical peel is more invasive. You're going to have 2 or 3 days of downtime
Yeah.
with
Okay. And we'll be right back after this break. But if you are looking for a great assisted living, be sure and contact Brookdale Assisted Living. They're located in Sumter, Harbison, and off of Park Lane Boulevard.
Senior Connections brought to you by our premier senior providers offering exceptional services for older adults. Our premier senior providers include Comfort Keepers of Columbia, comforting solutions for in-home care, anesthesiology consultants, board-certified anesthesiologists with more than 400 years of combined anesthesia experience, serving these fine institutions throughout the Midlands for over 25 years. Born-again Mosley Funeral Home and Cremation Service, our family serving your family since 1884. Cindy Loma with ERA Wilder Realty, a certified senior real estate specialist. Central Midlands Aging and Disability Resource Center, serving Lexington, Richland, Newberry, and Fairfield counties.
How have these homeowners achieved greater financial flexibility? With a reverse mortgage from a trusted source, MetLife Bank. If you're a homeowner age 62 or older, a reverse mortgage could make a difference in your life too.
It is the best thing we've ever done. I am so relieved.
It really lets me sleep at night.
Why not learn the facts today from a MetLife Bank reverse mortgage consultant? There's no obligation.
Senior Connections brought to you by our premier senior providers offering exceptional services for older adults. Our premier senior providers include Senior Living Guide, serving the Midlands for more than a decade. Life Care Center of Columbia, doing whatever it takes and then some. Harry Crosby, educating people on solutions available for long-term care for almost 20 years. Brookdale Senior Living, providing exceptional senior living for over 30 years. Aging Gracefully, a senior living consulting service.
We're coming back again to Senior Connections, and we're talking to Dr. Brill about the aging face and the cosmetic procedures that he does. Dr. Brill, tell us, why would you do a chemical peel on someone?
The chemical peel is a more invasive procedure. Usually they have deeper lines in the face or irregular spots, brown spots on the skin or dark spots, and the more superficial treatment may not be sufficient.
So you said that it would be about a 3-day downtime?
Yeah, it depends on the type of chemical you use, but the trichloroacetic acid peels are sort of a superficial peel, and it's 2 to 3 days of downtime.
Yes.
Now, are there any risk associated with that kind of procedure?
There's risk with any procedure, but typically with a light chemical peel, there's very few risk.
That's good. And that would have to be repeated at
It's-
what other time?
Yeah, it may be repeated in 3 or 6 months or once a year,
Yes, I
depending on the
see.
patient and how they aged.
And then how frequent can you have one of those IPL treatments?
Probably you would have a series of 6 treatments over a period of months.
I see. So you would come maybe every other month or something
Every
like
other, every 3rd month, and get a
Sure.
treatment.
Okay. Now, one of the things that I really think is going to be even more up and coming is this permanent makeup.
Yeah.
Because as we age, we can't see to put our eyeliner on
Right.
or our.
That's true.
Oh, that is very true. So tell us, how does that work?
Well, the permanent makeup is really a tattoo.
Is
And-
it?
There
and
we
we're-
go, a tattoo.
And we're putting pigment into different areas, whether it's your eyelids or your lip liner or your eyebrows. And so it's basically a tattoo. And we have a permanent makeup artist that just does only that.
And how long does that usually take?
It depends on the area that she's working on, and you may have to come back for a touch-up, but you could have your eyebrows done or your eyelids done. It may take an hour or an hour and a half, depending on the area.
How much does that usually cost?
I think she's charging approximately $250 to $500, depending on what she's working on.
Well, I guess you can make that up in eyeliner. Or
One way or the other. So you better like it because it's permanent then, right?
It
Especially when it
is.
comes to the
Yeah.
eyebrows.
She'll draw it on. So we have a lot of people
Yes.
come in that they don't have any eyebrows. And they,
Oh, that's true.
and
Because I don't
then-
have any eyebrows.
And then they put the permanent liner on, and
Yeah.
that saves them from having to draw it on every day.
and you can make arrangements to have them put on right after
Absolutely.
this show.
What did you say the cost was again?
Oh, well, I just think this is going to be a really big thing coming up because, like I
think so?
said, well, I know I can't see as well, and I'm tired of the magnification. You know, you
Right.
can only get so much magnification. But now I want to move a little bit into your surgical procedures because that is really where you shine. So. The eyelid, that just looks like a very painful procedure, but you said it wasn't.
Usually the eyelids are not painful, especially the upper lids. And you usually don't have very much swelling with the upper lids. The lower lids, you do have more swelling and more bruising. But it's still done as an outpatient.
Yes.
And it can be done with IV sedation. You don't have to be put to sleep to have it done.
And how long does it take to, recover from it?
Usually your stitches are in approximately 5 to 7 days.
That's not too bad.
So who would be the ideal candidate to come in maybe for just the eyelid surgery?
Well, we see patients who are starting to have droopy eyelids.
Ptosis,
It's not all necessarily cosmetic sometimes. It's impairing their vision, the droopy upper eyelids. And
Now, is that covered by insurance if
If-
they need that sort
if the
of?
visual fields are affected and you have a visual field test, yes, it would be covered by Medicare.
Makes sense.
All right.
Yeah.
And what about the lower lid? Then who would benefit from that?
We see our lower lid patients, usually they're having some fullness or bags, quote, bags in the lower lids. They look
Yeah.
tired. And those would be the candidates that would have it done.
If people have, the contact lenses, would they be an eligible candidate to have that done?
Yes,
So it
they
wouldn't make
would.
any difference then?
The only real contraindication maybe if they had dry eyes.
Okay. And we're going to take another break. And if you are looking for someone to help you with care or with placement, or you need direction with just general aging, call Aging Gracefully, and we'll be right back.
Senior Connections brought to you by our premier senior providers offering exceptional services for older adults. Our premier senior providers include Comfort Keepers of Columbia, comforting solutions for in-home care, anesthesiology consultants, board-certified anesthesiologists with more than 400 years of combined anesthesia experience, serving these fine institutions throughout the Midlands for over 25 years. Born-Again Mosley Funeral Home and Cremation Service, our family serving your family since 1884. Cindy Loma with ERA Wilder Realty, a certified senior real estate specialist. Central Midlands Aging and Disability Resource Center, serving Lexington, Richland, Newberry, and Fairfield counties.
How have these homeowners achieved greater financial flexibility? With a reverse mortgage from a trusted source, MetLife Bank. If you're a homeowner age 62 or older, a reverse mortgage could make a difference in your life too.
It is the best thing we've ever done. I am so relieved.
It really lets me sleep at night.
Why not learn the facts today from a MetLife Bank reverse mortgage consultant? There's no obligation.
Senior Connections brought to you by our premier senior providers offering exceptional services for older adults. Our premier senior providers include Senior Living Guide, serving the Midlands for more than a decade. Life Care Center of Columbia, doing whatever it takes and then some. Harry Crosby, educating people on solutions available for long-term care for almost 20 years. Brookdale Senior Living, providing exceptional senior living for over 30 years. Aging Gracefully, a senior living consulting service.
Welcome back to Senior Connections. We're talking with Dr. Brill about the aging face and the cosmetic procedures that he does. Now we're on to facelifts. What I would need to know, doctor, is the addiction part of facelifts in terms of people always having something done. Is that, a critical thing? Does that happen?
It does happen.
It does happen.
Some people are just never satisfied with the results they get, or think they should look better, or they think that they could have a little bit more improvement, and they are back
Yes.
and back.
Now, I know that you also do implants.
Yes.
Now, how do those kind of work with the overall facelift when you're...
I think they really do supplement the facelift. If you have sort of a receding chin, or if you need malar implants in the cheekbones, or if you need your nose done in order to help balance your face. I think there are other things that will help the facelift.
Now, are you seeing more men in your practice in terms of having these kinds of procedures?
I do see men, but the majority of the patients are female.
And the majority of these are not covered by insurance?
They are not.
Okay, okay.
When you say implants, explain that.
Well,
What
if
kind of
you,
implants are we talking about?
they're silastic implants. They're permanent implants. They're put into underneath the tissue of the chin or underneath the cheekbone
Oh, okay.
to give you more enhancement of
Yes.
the chin or the cheek.
So your area is not like what the plastic surgeon does?
Plastic
Little
surgeon
different,
is
or
doing the same
thing?
Maybe working in exactly the same area I am. I just am working from the neck up.
Oh, okay.
I'm just doing facial
right.
plastics.
Now, most of your work is done in the office or in the hospital setting?
We have a surgery center called Palmetto Surgery Center, and
Yes.
most of our outpatient work is done there.
So if you're considering, and I come to you and I say, okay, Dr. Brill, would it be better for you to do just my eyes, or am I a candidate for the total whole thing? I mean, who is the ideal candidate to have or start the total facelift?
Well, the first thing we do is put you on an imager, a computer imager, and we look at your face together, your face and neck, and we say, what really bothers you? Is it your neck, or is it your eyes? And
if they tell you everything, then you know they're a total.
So each patient is an individual. Each patient is different, and you have to tailor what you do to the patient.
Now, getting back to the addiction process again, how is it in terms of intervention? Is that oftentimes recommended? say if you had a customer or a client that came back and was starting to come back and continuing, would you refer them, to
Yes, I think
an analysis,
I
an
think that
analyst or
patient
something?
is someone that needs some help, and you ought to sit down and discuss with them that maybe additional surgery is not in your best interest, and that's not the
Yes.
patient that you would want to keep operating on.
Uh-huh.
Now, are there things that you do to prepare for a facelift?
In terms of the patient, well, I think the patient needs to know who's doing their facelift, what are their
Yeah.
expectations, what could they expect, how much downtime will they have, when can they get back to their normal activity.
And how long is that usually? How long does that usually
It's
take?
usually a week to 10 days. The stitches come out in a week to 10 days, and you may have restricted activity up to 4 weeks.
And what kind of activities would be
Like
restricted?
you might not want to be out in the sun and playing tennis
Yeah.
and things, or jogging, but you could be out going to dinner and shopping in about 10 days to 2 weeks.
Oh.
Well, this certainly has been an interesting discussion. And for those of
Absolutely.
you who are considering having some sort of cosmetic procedure, please give Dr. Brill a call, and he will be
Yes.
more than happy to talk to you. Also,
Very
if you
interesting.
are planning for long-term care, please give us a call, and we will send you this free guide, and pick up your current copy of Senior Living guide. This has now gone statewide. We have a ad in here with all of our wonderful sponsors. We are so thankful that you have been with us today.
Thanks for joining us, and we'll see you next week, and be blessed.
Thank you. For more information on the topics discussed on today's show, to learn about upcoming senior events and support groups in the Midlands, or to submit a question, go to seniorconnectionssc.com. You can also call us at 803-739-4205.
Thanks for joining us today, and be sure to tune in every Tuesday at 2:30.
Senior Connections brought to you by our premier senior providers offering exceptional services for older adults. Our premier senior providers include Senior Living Guide, serving the Midlands for more than a decade. Life Care Center of Columbia, doing whatever it takes and then some. Harry Crosby, educating people on solutions available for long-term care for almost 20 years. Brookdale Senior Living, providing exceptional senior living for over 30 years. Aging Gracefully, a senior living consulting service.
How have these homeowners achieved greater financial flexibility? With a reverse mortgage from a trusted source, MetLife Bank. If you're a homeowner age 62 or older, a reverse mortgage could make a difference in your life too.
It is the best thing we've ever done. I am so relieved.
It really lets me sleep at night.
Why not learn the facts today from a MetLife Bank reverse mortgage consultant? There's no obligation.